Thank you for the opportunity to present today on the cost effectiveness of multiple micronutrient supplements, or MMS, during pregnancy. My name is Jennifer Busch-Hallen, and I'm the Senior Technical Advisor for Maternal and Neonatal Health and Nutrition at Nutrition International. Over the next 10 minutes, I'm going to share with you NI support in generating cost-effectiveness evidence on MMS and translating this evidence into tools and actions for decision makers at country level. An outline of the presentation is shown here on the slide in the form of a timeline. I'll briefly walk you through the timeline, but as we go through the presentation, there'll be more details on each of the points. Firstly, let's start with the left-hand side and wind back the clock to about 2016, when WHO released the ANC guidelines for a positive pregnancy. At the time, MMS was not recommended, but the guidelines did encourage countries to consider MMS when there was known micronutrient deficiencies in their populations. However, at the time, there was no evidence on the cost effectiveness of moving from IFA to MMS. Yet countries were asking the question, is MMS better value for money than IFA? So in 2017, NI, together with Limestone Analytics, developed methodology and conducted cost-effective analysis for 3 countries, as you see noted on the left-hand side of the slide. This was published in 2019. And I then used this methodology to support countries at the time that were considering implementation research. These countries were Tanzania, Bangladesh, Burkina Faso, and Madagascar. And this implementation research was supported by UNICEF and the Bill and Melinda Gates Foundation. Moving into the middle of the timeline, in September 2019, NI committed to the Bill and Melinda Gates Foundation Goalkeepers, Healthy Mothers, Healthy Babies Accelerator. This accelerator aimed to advance and introduce MMS over the next 3 years. NI's commitment, one of them, was to finalize the MMS cost-benefit tool, make it publicly available and free online. In November 2019, NI was also asked by WHO to conduct additional cost-effective analysis using the WHO sub-analysis to help support the MMS guideline review process. This evidence helped influence the WHO update on MMS. And as we all know now, these guidelines were released in July 2020. And the recommendation on MMS during pregnancy changed from not recommended to recommended in the context of rigorous implementation research. So going back a little bit on the evidence, as I mentioned in 2016, there was a gap in the evidence on cost effectiveness on MMS compared to IFA. In 2019, 2 studies, as shown here on the slide, were published, each complementing each other. And both studies showed that MMS is cost-effective compared to IFA in the countries studied. The countries being Bangladesh, Pakistan, India, and Burkina Faso. A little bit more on the evidence. As I mentioned, as I mentioned on the timeline, NI and Limestone Analytics conducted additional cost-effective analysis to support the WHO guideline review process. We used the statistically significant estimates of low birth weight and small for gestational age from the WHO sub-analysis. And the results showed, in all cases, MMS remained very cost-effective in all scenarios across all 12 countries. The results of this work can be found in the report that's shown on the slide and now available on the NI website with the link at the bottom of this slide. So why did NI develop the MMS cost-benefit tool? And as I mentioned, it really was to help countries answer the question, is MMS better value for money than IFA? The tool has the capacity to estimate the impact of MMS compared to IFA supplementation for all significant health outcomes, budget impact, cost effectiveness, and the return on investment. And on this slide, you see a screenshot of what you would see if you went onto our NI website where the tool is hosted. What is the tool? We need a lot more time than the 10 minutes of this presentation, but you can find it on our website. It is quite unique and it's very user-friendly. And as I mentioned, it's free and online. It is driven by the evidence, but it is very rapid in generating the results. It's timely to have this tool because this is a question that many countries are asking. And now with the new updated WHO guidelines, to encourage countries to really move to implementation research, this tool can answer many questions. It is dynamic because it's interactive. Countries can, already we have pre-uploaded countries, but you can also enter, new countries can enter their own data and generate their results. More information on the tool and the methodology is actually can be found in a session, an on-demand session in this conference titled Cost Effectiveness and Cost Benefit of Delivering Nutrition and Health Interventions. And if you look for the presentation by Dr. Dylan Waters, Director of Health Economics, you'll find out more information on the methodology of the tool. But I am pleased to share with you today that we now have available results for 32 countries uploaded in the tool on the NI website. All 32 countries have available to them cost-effective analysis results alongside policy briefs for each of the countries. And as you see in the box here, you see the actual name of each of the countries that are now in the tool. And doing all the analysis for the 32 countries, we found in all cases, the findings show with high certainty that MMS is very cost effective for the 32 countries. As I mentioned, other countries can do their own custom analysis by entering in their nutrition and health data and running the tool to also answer the same question, is MMS better value for money than IFA? In terms of application of the tool, and what is very relevant right now is in relation to implementation research. As we noted, MMS is now recommended for pregnancy in the context of rigorous implementation research. It is important to note that the tool is able to answer a number of questions related to implementation research. And as countries embark on deciding their questions, they should consider what the tool is capable of answering. Examples of some of the questions that may come up in implementation research that the tool has the ability to answer are, if the coverage of IFA in my country is low, is it still cost effective to introduce MMS? If my government uses locally produced MMS with a different cost, is it still cost effective? If my country's low birth weight prevalence changes, would it still be cost effective? If my government requests cost benefit for 2, 5, or 10 years of MMS, can I decide whether it's cost effective? The tool right now has the capacity to answer all these questions for your country. So if you would like to learn more about the tool beyond this presentation, which is really just a flavor of what the tool is and what it can do, and answer cost-effective analysis questions for your countries, I encourage you to join us in the Learning Lab on micronutrient supplementation cost-benefit tool on November 17. In this Learning Lab, participants will learn how to run the MMS cost-benefit tool from start to finish and answer that question for your own country. Is MMS better value for money than IFA? Participants will access the cost-effective analysis for the 32 countries that are already in the tool that span the globe. They'll learn how to customize analysis to suit their own situation and learn how to modify some of the inputs such as population, supplement costs and coverage. And even you can look at how to add new countries. There will be case studies to demonstrate how to interpret the results, use this information to support implementation research, and showcase the other available knowledge products. So if you can, please join us. Even though on the slide it says November 16, we just got confirmation it's November 17. But if you would like to learn more right now, please visit our website and you will see the tool. And in that website, you see a user guide and a stepwise guide to taking you through the tool. And then you'll also see the policy briefs that are available on our website already generated. And as I mentioned, that's 32 of them. So thank you very much for the opportunity to present today, and I look forward to connecting with many more of you during the conference. Thank you.